Dr. James? No? If not, we're going to keep moving because we're going to come back to questions after, okay? Okay, Dr. Evelyn, you're up next.
Thank you very much. Good morning, everyone. Good morning. It is indeed a pleasure to be here with you beautiful people this morning, and I'm truly humbled to be here on this panel with these esteemed colleagues. Let me start off by saying this is a wonderful event. I've heard good things about the food, the massages, and many other things that we have on offer here today, and my job is not to keep you from any of these things. I've been told to give a short talk. The aim of this talk is really to speak from our experience and to basically outline our general approach to health and address, some of the concerns that, were raised from our experience in the community, I'm not sure how many of you are aware of this, but the Black Creek has had an initiative where we've been actually offering completely voluntary blood pressure, blood sugar testing to anyone on a completely voluntary, non-OHIP, no charge basis. And from what we have seen, it has actually taken off and has gone to places that we never imagined. It highlighted that there was a need there that we didn't even know existed. And with that point, I'd like to start with just this concept of screening. One of the things that really grasped our attention is that a lot of people that we encountered had no idea of the concept of what screening really is. The idea that to test someone who is completely asymptomatic, and I'll say this again, someone who is completely well, has no headaches, no pains in the back of the neck, as we say in our community, neck pains and back pains. A person who feels in their mind that they're completely well to get a test, it was an extraordinary barrier for us to cross. And we found that we were able to cross that barrier by meeting people in places that we actually went to where they were. We set up in malls, we actually found ourselves in shopping malls, at times in restaurants. We were quite frankly amazed with the results that we were able to gather. I mean, first of all, to explain to someone that even though you seem healthy or you believe you're healthy, look at the number on the screen. We were amazed to find at each of our clinics, we had at least one or two people who were just being diagnosed or just being screened to go on to be diagnosed for the first time in their lives. These people had no clue or concept of the danger that they were in. And so that brings me to my first point of access. We found our major challenge was access to information, knowing what screening is, knowing the importance of it, and access to that screening. We took for granted that even knowing the danger of hypertension, that someone with no symptoms in the province of Ontario could actually get checked for diabetes or hypertension. It sounds like a trivial thing, but what we realize is that there actually are barriers against it. Much worse during the pandemic, where most of the routine places, the family health clinics, were actually closed. So a lot of these health issues actually got pushed under the rug, and that is why we were surprised by the turnout. We were surprised by the attention that we actually got. And another thing that we found was, aside from access, engagement, a lot of the people that we actually encountered were people who were diagnosed for many years, just not taking the medication. And then we encountered certain barriers, like they just didn't feel comfortable with the health care that they were receiving. So there was a lack of trust, and instead of going on to relay, we all know that there are certain barriers that are unique to our population, cultural barriers, language barriers. And so instead of trying to explain to the doctor or nurse that they just don't feel well when they take a medication, most of the patients just prefer to sweep it under the rug, not take it at all, or defer to colloquial remedies like guinea hen and so on. And so we were able to actually break through a lot of barriers just by reminding people that, look, you can talk to us. We will tell you that this is actually dangerous. And what we uncovered was an amazing or alarming lack of insight. A lot of people with chronic medical conditions were content during the pandemic to stop taking their medication altogether and just continue as if they were completely oblivious to the dangers that they were in. My colleagues can attest to times where we've had to call 911 from screening clinics where people were just walking by casually in the mall and had systolic blood pressures over 200. Random blood glucose in the range of the 30s. And these people have been diagnosed and off medication since the pandemic and and they give reports of their medical practices closing during the pandemic, and they just never sought medical attention. They just continued living life as though they were completely cured. So the last thing I wanted to say is just to emphasize that we have had success in convincing people, because chronic illnesses such as diabetes and hypertension, as my panelists alluded to, they're silent killers. You may not necessarily feel, but heart attacks and strokes as an end result can actually result in death, and hence the name silent killer. A lot of people were fortunate, and that is why we are inspired to carry on our good work, because we think that there is a need, and we definitely see there are people they need assistance, they need guidance, they need access to medication, they need access to information, and they need access to screening. I'm just going to stop there for questions and hand it over to our distinguished MC. Thank you very much.
Thank you, Dr. Evelyn. Do we have any questions off the top for Dr. Evelyn? We're going to circle back because there's a lot going through my head as I'm listening, and I will start off our questions if you don't, because, for both of these doctors so far, it's resonating because this is in my family. My family tree is aligned with everything that happens across this panel. So I'm hoping that we can all pay attention because there's a lot to be gleaned here. If we could take down the decibel again, just a reminder, take down the decibel. We're going to go over to Natasha Batchelor. She's also going to talk to us from a clinician lens about some of the things she's seeing in our communities, okay?
So I'm going to hand it over to Dr. Omole to go first because we're talking on similar topics, so I'll fill in kind of the gaps.
Good morning or almost afternoon, everyone. Thank you so much for Black Creek Community Health Center and the Jamaican Canadian Association for having me today. It's been probably about a year since I've been here doing the vaccine initiatives before, so it's nice to see some familiar faces. So as our wonderful moderator first noted that I'm a breast surgical oncologist and a general surgeon, and I practice out in Scarborough as part of Scarborough Health Network. So my focus of practice is breast cancer and dealing with it from the surgical point of view. I'm sure that most people here have heard about breast cancer, have an awareness of somebody in their family with breast cancer. The first thing I want to always tell everybody when we talk about breast cancer is that breast cancer is not a death sentence. We say that even from stage 0 to stage 4, the overall survival in Canada is still 87%. And a lot of that, so that means if I put 10 people in this room who've had breast cancer, I expect that 8.7 of them will still be here in about 7 years. So that is really great progress that we've made, and a lot of that progress has been made in treatment for breast cancer. What there hasn't been progress in is the rate of mortality associated with Black women and breast cancer. First of all, I always want to make it clear when we talk about Black is not, it's our skin color. There's nothing necessarily in the groups of people that make up Black people that is genetic. For example, when you talk about people from the West African region, so that would be me, I'm Nigerian, that would be people from part of the slave trade, so Black Americans and the Caribbean, Jamaicans, we have a different incidence in terms of the kind of breast cancer we have in the triple negative breast cancer. On the other part of the continent, when we talk about people from Kenya, from Ethiopia, they have a completely different type of breast cancer, which is, y'all, this is loud. Can we guys just please lower it? Because I see that there's some people on the front who are trying to listen to all of us talk, and so it's just a little bit loud for them. So when we talk about people from the eastern part of Africa, so Somalians and Ethiopians, they actually have a type of breast cancer that is estrogen and progesterone positive, which means that if we gave them a whole bunch of estrogen, such as like if you're pregnant, this cancer will grow. So even groups that people that we consider black, we have different types of breast cancer within them. Altogether, though, one thing that is very clear is that when you look at the UK and the US, because currently in Canada we don't collect race-based data, we do notice that even though black women and white women have exactly the same incidence, so it happens just as often within black communities and white communities, there's a difference in the survival. We find that black women have a 40% increase in the risk of dying from breast cancer than white women. In the US, it's a little bit hard to decipher because with them, a lot of it is access. The UK, though, they have exactly the same system as ours, fake two-tier system, but the same thing that we notice is that women who are from people who are from black ancestries do have a worse mortality. So what explains that? One of the main things that explains that is the time of diagnosis. I am in Scarborough. Scarborough, as I love to proudly say, is the most diverse area. I know I'm not in Scarborough right now, but I always am from Scarborough. And Scarborough has the highest diversity of any area in the GTA. But we get the less money. So for all public health, we would like some more money in Scarborough. And so what I see in my patient population is when I see someone who's Caucasian, someone who's Asian, and socioeconomics does matter, they tend to present at stage 0. So that is the pre-invasive breast cancer, or stage 1, so like a very small mass that you can't even feel that it was caught a mammogram, versus when I see black women, women from certain parts of the Middle East, and Southeast Asian, like Tamil women, present at stage 3 disease. That is a huge difference. You go from, it drops your survival, but it also increases the amount of treatment that you're having. So you go from the beginning where it's just surgery, maybe radiation, and then you're done your treatment, to chemotherapy, and then to having to take hormonal therapy. So that is a huge difference that we notice. So part of it is screening. Currently, the guidelines say that women in Canada should be screened, people should be screened at the age of 50. However, the Association of Canadian Radiologists have actually said we should really lower that to 40, and especially in the black population, because we know about this mortality, we should start screening at the age of 40. The problem with that is you can't go to Humber with Natasha to the OBSP, so it's just the Ontario Breast Screening Program, at under 50 without a doctor. So that becomes a problem because we have a lack of family doctors. Part of this is really advocating, and for us to be able to say, you know what, this is an at-risk community, so therefore there has to be exceptions in the policy that says, you know, you're 40, if you don't have a healthcare provider, but you're worried, you really should be going to be able to get screening. I see patients, my specialty is younger people with breast cancer, so I see people as young as 24, all the way obviously to like 90. But I will say the bulk of people that I am seeing are under the age of 50. We don't want you to have a lump. I don't want you to feel a lump, because when you feel a lump, that is probably a stage 2, maybe a stage 3 disease. We want to pick something up on your mammogram, and obviously if you have younger breasts, Natasha will talk more about that, they will do ultrasounds. One thing that I am noticing in my practice is that during the pandemic, the black community was very much targeted in terms of misinformation and distrust of the medical community. People come and they tell me that, no, if I get this mammogram, it's actually going to give me cancer. The mammogram will not give you cancer. The amount of radiation you're getting in a mammogram is less than you taking a trip back home to Jamaica, back and forth. So you have to think of it that way. And then people are always afraid of the treatment. That, well, how can I trust this? What about natural medicine? I come from Nigeria. I grew up with both regular medicine and also the things that my grandparents gave us when we were sick. I'm a big proponent of combining both. There is a role for anyone that tells you they're going to cure your cancer with mushrooms is lying to you. But if they tell you, you know what, we can support your system, we can help you with nutrition to help with prevention, everything that Dr. James and Dr. Evelyn talk about, diabetes, high blood pressure, obesity, all of those are risk factors for breast cancer. So if a practitioner is telling you that we can do different things, there are different supplements you can take to help boost your system as you're going through treatment, that is a good healthcare practitioner. I have naturopaths in my family. I see a naturopath. And so I tell people that we all work together. We can work holistically to provide you with the best care. There are nutritionists who specialize purely in oncology, who can help you in terms of what do I eat now? Because everyone starts being afraid of what they can eat once they get diagnosed with breast cancer. There are nutritionists who can help you, give you information to help guide that. I understand that there's a distrust in the healthcare system. We come from parts of the world where medicine has not been kind to us. There have been experiments. People talk about Tuskegee, but there are things that have happened in Canada, things that have happened in Nigeria. My mom, at the beginning, was like, oh, I don't know about this vaccine. I remember when they came with the polio one, a whole bunch of kids couldn't walk after. I thought she was making things up because she's almost 80. She wasn't, because when I researched it, there was actually some truth. It wasn't experimentations, but when they first started giving the polio vaccination in sub-Saharan Africa, they started with Nigeria, and there were complications initially. So this is the things that she still has in her mind, and she was like, I don't know if I want to take any vaccine because this is what has happened in the past. So we have to remember that when we're talking to our community, that they've had experiences of mistrust where the medical community has, to be quite frankly, has been abusive to our people. That we are trying to change. You have healthcare practitioner, allied health, all here who are committed to our community, who want to help our community. And I don't want you to come with a lump. I want you to find something that we find on your mammogram, on your ultrasound, that we can easily take care of, that your treatment lasts 6 months, and then bye-bye, I don't have to see you anymore, versus that we're going to be being in treatment for 2 to 3 years. So that's what I have to say. Thank you for listening.
Thank you so much for having me. Just to reintroduce myself, my name is Natasha, and I'm the breast health supervisor and navigator at Humber River Hospital. So to piggyback off what Dr. Mole was saying, I'm going to talk more about the screening kind of aspect of breast cancer. So like my colleagues and panelists were talking about, so screening is when we're looking for something when you feel well. So with breast cancer screening, we're screening people that have no symptoms, nothing's wrong, it's just like a checkup. You're coming in to get checked. So what we're doing is, I'll walk you through kind of an example of what screening's like at Humber. So you're coming into Humber River Hospital, you're gonna come up to the 2nd floor to our beautiful breast health center. So you're gonna check in with our front desk staff who will register you, and you'll get changed by either our volunteers or by the technologists themselves. For the actual mammogram, the technologist will go through a series of questions with you to garner your family history and other risk factors that may increase your risk of breast cancer before your procedure starts. You guys will be changed from the waist up. There's no underarm deodorant or powders for your mammogram, just because that can affect what we see on our equipment. The technologist will perform the mammogram with you, and the one beauty of getting your screening done at Humber is that we have like a one-stop shop. We have breast surgeons in our department. We have myself, the navigator, in our department that can facilitate patients through the journey to get to your surgeon if you need that assistance. So once your mammogram is complete, it is reviewed by a breast health radiologist, and if required, we can do same-day imaging. So if the mammographer does your mammogram and they see something that they don't like, something that looks suspicious, that they're concerned that this is a cancer, they can go right then, same day, show that to that radiologist, and you could potentially have an ultrasound the same day, and if we have capacity, sometimes you can even have your biopsy done the same day. Depending on the day, sometimes we can bring you through the whole whole process, depending on the date and depending if you want it. Because I know some people coming in for a mammogram and then we're going all the way to a biopsy. It can be a little bit too much for people. But we are able to facilitate that entire process. So like Dr. Molly was saying, we have in Ontario what's called the Ontario Breast Screening Program. And what this program is, it's for women between the ages of 50 to 74. You can come in to any site that's an OBSP site and have your mammogram. The beauty of this is you don't need a requisition. So you don't need any paperwork from your doctor. You just call the location you want to go and you book your appointment. The other thing is you can't have any symptoms, and you can't have implants or have a history of breast cancer to be in the general breast screening program. The other thing that people, like Dr. O'Malley was speaking about, how a lot of people don't have access to a family physician. With the OBSP program, you don't need to have a family physician. So that's not a barrier for you to enter the program. You can still come and book your appointment. If for whatever reason you do not have a family physician and we do need to do additional testing, biopsies, special pictures, or need you to see a surgeon, we do have a physician on site that we can attach you to facilitate that process. So not having a doctor is not a barrier for you to be able to be screened if you're within that age range. Unfortunately, within the program right now, under 50, you do need a requisition. So it's not that you can't do a mammogram. I don't want people to think, oh, I'm 40 and I want a mammogram, but I have to wait. That's not the case at all. But we do need that paperwork from your doctor between the ages of 40 to 49 to be able to book that mammogram for you. So the beauty is we're the one-stop shop. You can get everything done in one place. During COVID, one of the huge barriers were mammography was actually, I don't know if everyone's aware, mammography was shut down for about 2-3 months. Unless you had a symptom, there was no screening. So this created a massive, massive backlog, coupled with a lot of mammographers retiring. They're saying, forget it, I don't want to work through COVID, like I'm done, tapping out. So there's a coupling the huge backlog of no mammograms being done, a lot of mammogram techs retiring, a lot of new people not going into that area can create challenges for people accessing to care. We've been very fortunate here at Humber where we've been able to retain the majority of our technologists and onboard younger technologists. So fortunately for us, we haven't had a capacity issue in being able to service our community. But there are a lot of other areas who unfortunately can't say the same. So I know Ontario's still working through the backlog of screening cases, so it's very important if you're not up to date with your screening, which it should be done every 2 years between the ages of 50 to 74, then it's time to book your mammogram. Just call and book. We're happy to help you out at Humber River Hospital and facilitate you getting those screening tests. But it's so important that we don't delay these diagnoses because of COVID and because of people forgetting. 2 years passed, your 2 years was during COVID, it kind of slips your mind, you forget about it. We're starting to see a lot of people with cancers at later stages where before we might have caught them earlier without the delays that COVID has caused. So it's very important that we kind of come back and get back to our screening schedule so that when you go see Dr. Amole, she's treating a stage 0 or stage 1 versus a stage 4 or a stage 5 cancer.
So I know I talked about breast cancer, but I'm a surgical oncologist, so I have to also talk about colon cancer. So at the age of 50, you should also be screened. You can either do a colonoscopy or you can do a very simple stool test called a FIT test. You do it in the privacy of your home. You send it to the lab and you get your results. It's looking at if there is DNA for polyps or a cancer, usually polyps in your stool. So also at the age of 50, you should be getting your screenings for colon cancer.
Thank you all panelists. We're gonna go into some questions. I'm highly triggered by this panel because everything here is a challenge in my bloodline. So let's get going with one of the questions I have is across the board for these chronic illnesses that we're talking about, what are the myths or misconceptions that are impacting care that you would love to dispel here and now? So for example, You know, black folks, we like to give things names, right? So when we were growing up, thank God we've gotten over this, we used to call diabetes what? Sugar, right? And, and I think maybe it's because the measurement that was taken is of your blood sugars, but somewhere along the line we started to call it sugar. And I think that it's a bit of a myth because that's not the only indicator in your lifestyle that you should be addressing for diabetes. So I'm going to go across the panel. Just think about the things that you're seeing when you deal with people. What is the biggest myth or misconception that you'd love to dispel here today?
Well, I think that a lot of people don't want to feel that they're going to be impacted by what it is that they have, because it's a name, right? So, and it's common, diabetes is very common, and it's good to have a very positive outlook. I actually do think it really helps to be positive, but the biggest problem is ostrich head in the sand. So the longer we delay what it is by ignoring it, I guess the myth is if you ignore it, it isn't there, but it is, and there can be so much that's done to prevent complications that if you run away and hide from it, it actually is going to lead to a worse outcome. And I think another one of the, not so much myth, there's always some truth in a myth, is that drugs are bad. Drugs, medications are bad. There's big pharma. It's always there to just sell their product. And you don't need to take these big pharma drugs because it's all a big conspiracy to get you to take medication to fill their pockets with money. And there have been problems in the past where studies have been suppressed if they were negative. There have been issues where pharma has had too much influence over the practicing physicians' prescriptions and what they do. But over the years, we have really, in our particular field, made a big effort to look at the evidence and to very carefully evaluate the evidence of how these medications can be positive or how they can be negative and balance them. And there are still some very old drugs. They're all generic. There are companies that make generic drugs, which means they don't make as much profit. They've come off patent. And if finances are a problem, then they can certainly be entertained as good substitutes. So I think a couple of things around making sure that you have a very good conversation. If you have concerns about the safety and efficacy of a medication that is being prescribed by your clinician, either your nurse or your doctor, that you have that conversation about what it is that can ensure that it's going to work for me and have an understanding of how it works. But know that if there are side effects, you report them. And so the most important thing is, which is a problem that I encounter a lot, people will have a side effect, they stop taking the drug, but they don't tell me. Like if they just told me, we would work together to find something else. I only find out 6 months later when they come back that they've stopped taking the drug because they developed a side effect. And then we're back to the cycle of either having high blood sugar or high blood pressure or high cholesterol when we could have had a conversation in order to prevent that from happening. So any side effects that you develop, please tell your care practitioner.
Good morning again. As it relates to dispelling a myth, I think the biggest myth that we've encountered is the confusion between the terms control and cure as it relates to a chronic illness. You'd be surprised how often we've met people that with elevated blood pressures, and we would ask them, so have you ever been diagnosed? They would, do you have hypertension? They would say, no, I do not have hypertension. You said, okay, but have you ever tested your blood pressure before? Yes. Was it elevated? Yes. Were you prescribed treatment? Yes. Do you take that treatment? No. How come? Because after I started taking it, the blood pressure became normal, and now I am cured. I am no longer hypertensive. You'd be very surprised how often we encounter this. It is a myth. That is called control. It's not a cure. A chronic illness is not going to be cured. It's something that you live with. There are times in your life where your control may be better than other times, and that's where your physician comes in, that's where follow-up comes in. But to abandon care altogether with one normal reading, it's a huge myth, provides a huge challenge and a huge barrier in our community, and it's something that we encounter too often.
So I've been a practicing mammography tech for over 12 years, done thousands of mammograms. And I would say the biggest one is people think that mammography is going to be so painful, so they don't want to go because it's going to be so painful. And I can say of those thousands of mammograms I do, there's maybe 1% that finds it very painful. But they always speak the loudest. So unfortunately, that's the message that gets spread around, that it's this terrible experience. It does not have to be. The majority of the time, it is not. Mammography is what I call a team sport. We work together to get those pictures. If you're feeling uncomfortable, I can switch something a little here, a little there to make that a little bit more comfortable for you. But for the majority of people, they find it a very tolerable exam.
I just want to add, because, you know, I'm a woman, so I've had mammography, and my sister had breast cancer, so now I'm going more often. It's pain, but for a very short period of time, maybe a split second. It's not the most comfortable, but honestly, it's over. It doesn't last. I think that's the truth, is you go, ouch, and then it's gone.
I don't know, that myth kind of that myth kind of lingers. Everybody says it's painful. I'm happy you said that, you know? I'm very happy you said that, because so many people don't go and do screenings because of misconceptions. Dr. Omole, do you have any for us?
So just on that, I think we have to separate pain from discomfort, because when I exercise, she asked me, she's like, "Are you in pain?" Like, no. She goes, "Then keep on going." So I think that is something that's like the human mind, is that we think pain and discomfort are the same thing. It is, I've had mine, it is uncomfortable, but it is not all ending. And so we just have to understand that it's for a short period of time for a greater good. I think I've already kind of addressed some of the myths that I see. I think oftentimes people don't think that Black people are able to have cancer, and I think part of that is we don't talk openly about cancer, about mental health in our communities. People hide that. I know people who literally told no one in their family but me separately that they had breast cancer 20 years ago. You having breast cancer does also affect your siblings, because they should be screened more often. So I would say that people just think that Black people don't get cancer is not the truth. We get cancer, we get all types of cancers.
We get a lot of the chronic illnesses impact us. And, you know, one of the things that was, I would say, a common thread across the panel is the interconnectedness of all the lifestyle things that impact all of our chronic illnesses. And, you know, today at this, family health fair, we have all these representatives here that, can help you to understand these illnesses better, but also help you to relieve some stress. You know, stress is a silent killer, isn't it, Doc? So we would really like for, as we kind of round out this panel, for you to give, for me, it's really the call to urgency around these illnesses. So based on your experiences as clinicians, what are the things that you want us leaving here today, like going, this is what I need to get on top of because I haven't been paying attention to this, or I missed it, or I don't understand the connection between all of my lifestyle, practices and wellness. And so I'm asking each panel member to speak from that sense of urgency, especially for our Black communities, as it relates to the illnesses that you have seen or dealt with or have screened for.
So I think one of my key messages is once screening is done and it's identified that you have diabetes, you need a relationship with a clinician for the rest of your life. And in primary care, unlike specialist care in general, I mean, when I see a patient, I make sure they have an appointment booked for the next time. And if they don't come, we remind them. But when you don't have a regular family doctor and you're not part of a health team that's helping you to actually set up regular routine follow-up, that regular routine follow-up, even when you're feeling well. So you absolutely go. You're going to the doctor, you're feeling good. And actually, it's a good thing you're going when you're feeling good. And you're getting everything checked, sugar, the blood sugar itself, the cholesterol, the blood pressure, the urine test to make sure that kidney disease isn't developing. You're getting reminded to get your eyes checked so that there's no bleeding in the back of your eyes that can be prevented. You're screened for heart disease. All of those things, they happen routinely. And so people have to set in their mind that I'm going to have a relationship with my healthcare team forever. Forever.
Can we take down the noise just a little bit again? Can we just give our panelists a chance to address the questions? And if you have questions, like, let me know so that we don't, lose this opportunity to talk to these experts. Okay, Dr. Evelyn.
Thank you so much. Just to piggyback on what my esteemed colleague said, the main thing is take control. If we leave here with one message to you, it would be take control of your own health. I can't tell you how important that is. Almost every time we do these clinics, we encounter so many people that would sit at the table, have elevated readings, and you would ask them, say, how do you not know that this is so abnormal? They would say, every time I go to the doctor, it's normal. Okay, so what is normal? They have no clue. What numbers do you get? No idea. Do you test it at home? Never. How often do you see the doctor? Whenever you get an appointment. And if you miss that appointment or we don't follow up, you see, if you were to compare, unfortunately, we are the group that are at highest risk, not just for the chronic illnesses, but for the complications. We're also the group that are sadly, that doesn't really take as much accountability or responsibility. So take control would be the best message I can give. Take control of your health because no one can do it better than you. You be the one to be aware when the appointment gets missed. You're the one to know what the numbers are. Keep a diary. I have an illness that will be with me for the rest of my life. I should know what my numbers are. I should know when my health check is due. I should know when the next appointment is. When are my quarterly labs due? What is my cholesterol like? You'd be surprised to know how other ethnicities actually pay attention to these things in such detail that they would come into the office and tell you, oh, it's time to actually check my cholesterol, doc. I don't know. When was the last time we had an A1C done? I've noticed that the last one was 3 months ago because they actually pay attention. And if we could do that, I think it would make such a huge difference in terms of alleviating just the complications of chronic illnesses in our population. That's just my observation.
So my main takeaway message would be, if you haven't already gone for your mammogram, book your mammogram. It's very easy to book your appointments, and make sure it's not just booking now, it's continuing to go regularly. It's great you went once, but you need routine screening, right? And if you're noticing any symptoms, any changes in your breast, these aren't things that one should be ignoring. You need to go see your physicians and make sure they fax over the appropriate paperwork so that we can facilitate your mammograms for you that way as well.
So similar to what Natasha said, get your screening. If you're under the age of 50, speak to your family doctor. Talk to them about the fact that there is an increased risk in the Black community, and so therefore you should be starting screening at 40, and it should really be every year. So it's that conversation have with your family doctor, the nurse practitioner, if you're on a family health team, and have that conversation with them about that. I also just want to reiterate to everybody that at the end of the day, you know your body better than anybody else. you are the master of your body, but I am the master of the disease. So we work together to find the solution that works for you. We'll talk about the treatment. I'll give you as many options as possible. At the end of the day, it's your decision, and I want people to feel empowered. I would say that oftentimes when we talk about different communities and their ability to just be on top of certain health things, chronic disease like hypertension, diabetes, part of that is that we are part of a disenfranchised group, and we have been oppressed for many, many centuries. And we are just now learning how to do some of these things. No one expects you to be an expert anytime soon, but it's just even asking, what do I need to do better? Like, how do I take care of my diabetes better? What do you need? And just have, and I think it is difficult. I've noticed, like, even for me, when I was going through labor 3 years ago, I couldn't advocate for myself. My cousin, thank God she's an she's an obstetrician, she was the one advocating for me. So I know what it's like to feel disenfranchised as a Black woman, and I'm also a physician, and it was in my own hospital. So it even felt worse, but I think it's sometimes taking somebody with you and say, what are the things that I need to know? What are the things that I need to be writing down? What do I need to track? I think when you go in and you have that conversation with your family physician, and if they're like, well, nothing, you're like, no. I'm happy to book another appointment so we can have this conversation. Because to be honest, that's our job. Our job is to help educate and health promotion. So have the list ready of the questions you want to ask them. And part of that is, we have to teach each other, and you have the opportunity today to ask. There's good places on the internet to find information, and it's to find those, and a lot of the associations are good places to find that information. And so how to, because part of it is like, we're like, take care of your own health, but you're like, I don't know how. We can work together to teach you how to take care of your health. The other last point I want to make is oftentimes people always ask me the role of hair relaxers, hair dyes, and breast cancer. Currently, there's no evidence for the increased risk of that. There is an increased risk of uterine cancer with relaxers when you do it more than 4 times a year. I would say that at the end of the day, all of these are hormone-based cancers. So my recommendation I always tell people is that, yet we don't have the evidence, but what we call the chemicals are endocrine disruptors. So they affect your hormone changes. So I would tell people, if you're going to relax your hair, because I love bleaching my hair like all the time, but I've cut it down to bleaching it 3 times a year. That's why it looks like this, because I haven't bleached it yet. I'm waiting. I can't wait. April is getting bleached. So I understand. So all I'm saying is that, when it comes to relaxers and bleaches, is to do it less than 4 times a year. That's when we know that there's less of a risk of cancers like uterine cancer.
Dr. Omoli just stressed out all the women in the room. You look fine. Our situation was when you talked about the relaxers. I've been natural for years, and now because of other illnesses, I'm bald. But I saw her face, she almost died. But information is important. Knowledge is power. And we want to thank our panelists. Do you have any questions for our panelists before they go? They've spoken to us on all the chronic illnesses that they represent. We're talking about diabetes. We're talking about cardiac-related illnesses, hypertension and high blood pressure. And of course, we have our oncologists and our our technician and navigator to talk to us. Any questions?
Not a question for the panelists per se, but I know today we have blood pressure checks, blood sugar checks, we even have foot care, but can we book a mammogram today at your table? Okay. Okay, perfect. But if you want more information about booking that mammogram, the table's over there. Thank you so much, all of you.
Okay, any other questions or comments? Okay, so I'm going to release our Who? Come, come, come.
How to prevent the uh, breast cancer?
How to prevent breast cancer? I don't know if we can answer it in one day.
So I would say that the majority of what we know about breast cancer is that it's just, unfortunately, shit happens. But there are things you can do to lower your risk of breast cancer. One of them is mammograms, because we can detect things before they become a cancer, and so you don't have cancer. So mammograms is probably our main one. The second thing is really just all of the same things about chronic diseases. We know that obesity, high blood pressure, diabetes, chronic illness increases your risk of breast cancer. So lowering all of those is very important. And also, you mentioned before stress. We don't really know what the full impact of chronic stress, constant cortisol surges in our body does. I think we know part of what it does for chronic illnesses like high blood pressure, but in terms of cancer, we don't have that fully fleshed out yet. I think it's impossible to say that something that can make your blood pressure worse couldn't affect your risk down the line of cancer. So I was just generally like just being as healthy as you possibly can. It's not to look a certain way, but it's, getting, is it 30 minutes a day? I'm supposed to be walking? 30 minutes a day, eating as much, fresh vegetables and, am I right?
Yeah, 150 minutes a week. They increased it.
150 minutes a week of exercise. And when everyone says the same thing to me, oh, I walk a lot. No, you need to actually exercise. There is a difference between walking back and forth and cleaning your house on Saturday and actually saying, I'm going to dedicate this time to exercise.
Thank you, Dr. Omole. And Dr. James, quickly talk about prevention as it relates to diabetes.
So diabetes, I can say, can be prevented, and that's a strategy. We know 100 to 150 years ago, we just didn't have as much diabetes in the black populations of the world as we do now. And a lot of that had to do with the changing in lifestyle, reduced amount of physical activity, foods that were more dense in calories and fat and sugar, that they're lovely, but they end up making us heavier than we do needed to stay healthy. So number one is working in very, very healthy eating, working in regular activity, and impressing that upon your children. And I think also making some changes in what we think are culturally acceptable. We've gotten used to thinking of ourselves as bigger people. I think we have to start modifying it a little bit and looking at deciding what beauty is, and thinking about that as well, because that can be a bit of a barrier. I mean, I often will have people say, well, I feel fine and I like my weight. I'm saying, well, your weight is going to increase your risk of diabetes. So for sure, very healthy eating, keeping a healthy weight, and staying fit. Yep.
The challenge is on. Go ahead.
Yes, so my question has to do with, so I come to some of these events, and I'm armed with all this information. I go back to my doctor and, and I start, should I get this test and that test? And they go, well, you're too young, How do you deal with that?
So we're on an advocacy tip now, right?
So I would say that I think that is very challenging. I would say that for men, like we talk a lot about, they say in the general population, prostate screening with PSA is not important anymore routinely. But when you actually look at different data, it shows that with black men, it actually is something that should be considered. I would say that maybe something we need to do better as when we come to these talks is actually being able to give you where to go. So you can be like, nope, actually, This is where it says that. So that's something that I'm happy as part of BPAO, the Black Physicians of Ontario, to work on. And as part of like because I do think that that's really important, because it's great for you to say, well, there was this doctor, I can't remember how to say her name, she said I should get a mammogram, and then your doctor says no. So then where are you left with, right? And so you're right, thank you for bringing that to my attention, that often we need to create a place to go so people could actually have where they can get the information to present to their doctor, because not every doctor knows about Black health, and that's the honest truth. So I don't have an answer, but thank you.
Dr. Evelyn, you want to take a attempt at it as well? How do we better advocate after hearing all of this information?
The one thing I would say to that is you will find information varies, especially among health providers. A good approach would be, if you have the internet as a resource, the word guideline is a very powerful word. Guideline. The U.S. Preventative Task Force Society was tasked with this very thing, deciding what age people should get screened for what. That information is available to the public. So if you were to go to a physician and say, I would like to have my blood pressure checked, I'm 35. He says, no, you're too young. He says, well, actually, no. Again, according to the U.S. Preventative Task Force guideline of 2015, I should get it checked from age 15 onward. Then the doctor would have to refute that. He'll be like, well, in my opinion. And then more often than not, he'll probably just concede to doing it. I agree, it is a challenge, because you almost have to be a physician to know this, right? So I am in the same boat as my panelists here. It's very difficult. I would say the only thing that you can arm yourself with is information. You can never go wrong with information. As long as you're not aggressive or abrasive to a physician, more than likely they will relent, or they will listen to what you have to say. And if there's a good reason not to do it, they will attempt to explain to you. Because Dr. Google doesn't know everything, believe it or not. Clinical experience still trumps Dr. Google. But it does count your information, or you being informed does help you, or takes you to places that, that otherwise you wouldn't. So just be informed about the thing. Every visit that if you know that you're going to see the doctor next week, as Doc says, have your questions ready. I researched this, I found this, what is your opinion? And not just, I think I should get this test, and Doc says no. It puts you in a better position if you're well researched, you understand what you're going to ask, you know the things that you want to ask, and you know the reasons. That helps you so much more than just randomly asking stuff. I don't know if that answers the question, but...
Sorry, I talk a lot, I'm Nigerian. One thing that I would add, though, that I would say is like, sometimes you do have to get abrasive. Because I would say this as a Black woman trying to advocate for myself, I wasn't heard. And it took my cousin to actually say, no, this is what, she talked about, this is what should happen. Right? So I would say that it is challenging. That I think there's a fine line between being abrasive and being assertive. Always be assertive. Always be true to who you are. I mean, don't cuss anybody out to their face, but you can cuss them out later, but just don't cuss them out to their face. But sometimes you do really have, especially I think as a woman, is that sometimes I'm afraid of being labeled as the angry Black woman or as being a bitch. But you know what? The squeaky wheel gets the grease or something. So sometimes you do have to go a bit outside of what you think is your comfort zone to advocate for yourself.
Thank you very much. Any other questions? Okay, if that's the case, I'm sure our panelists will be around. Some of them are affiliated with tables that are in the hall, so you can also visit with Humber River and so on and find out more, be informed, arm yourself with knowledge. Go ahead. You have a question for us?
You're just dealing with diabetic, right?
Either. Dr. Evelyn was talking about that.
Yeah, I have a question about the high blood pressure. I have high blood pressure, and the medication that I was on when I went to the doctor, my feet was all swelling, I'm getting itchy, and, I was talking to a relative that is a registered nurse, and when she looked at it, she said, you should go back to him and talk to him to let him move. And then this is what he said, but that's the one that worked best for you people. And I really don't know who your people is, so,
Hold on. Can we get a little bit lower? This lady has a question related to hypertension. Okay, right?
Yes, yes, yes. So I was on this medication that he put me on because I said I was borderline. And when I take the medication, my ankle was all swollen, I was getting itch, and I have all kind of things. And I talked to a relative who is a registered nurse, and she said, go back to him and let him take you up because this is what it does. So and I went on the internet and looked at it as well. And he said, well, that's the one that worked best for you people. Didn't want me to take me off of it or anything like that, but I just insist. So I don't know which one really worked best for you people.
Okay, now we've gone into another zone. Talking about the ways in which they speak to us in healthcare, but also as it relates to her medication giving her side effects. I know, right? Like, Dr. Mole is ready to take off the earrings and get the grease. So we're going to try to address it as best as possible.
So without knowing what medication it is, but I think the message is there are certain classes of medications that we think are better for certain people and certain types of high blood pressure and what it comes along with. The good news is that many of these classes of medications, they can be switched out. So even if you think, I don't know if it was a calcium channel blocker, that's the one that commonly causes some swelling, that you switch it from, let's say if it's nifedipine, you switch it over to amlodipine, and then you see if the person still has problems with swelling. So I think the thing is that, yeah, there are side effects, and there are some medications we think are very effective, and they might be indicated because you have a certain other condition. But there are always options, and so exploring those options, if that problem is bothering you enough with your clinician, your physician, whether it's a nurse or a doctor, is important. That's for sure. I'm guessing what it was she was put on.
I couldn't have said it better myself. I think she hit the nail right on the head. I would venture a guess that what it sounds like you're describing is a conversation between a physician and patient where he's trying to reassure you that that what you're experiencing is a side effect and not an allergy. Because sometimes physicians do that. They explain to the patients that, oh, you're not allergic to it. It's just one of the common side effects, and there's a way that you will get over it in time. I think one of the things that it is a challenge that physicians face. A lot of times, honestly, physicians are just used to using this particular type of medicine. A good way to approach it would be say that, well, I understand it's not an allergy, but I will not take it because I don't like the side effect. So if you prescribe it to me, I will not take it, and we will not get to our goal. I think that's a good way to relate that information to the doc. And I think a lot of times we don't. We will listen to the doc. He will say, this is not an allergy, a bit of swelling is common, over time it will go away, and then we leave the office. But we're doing ourselves an injustice. And a lot of times we encounter this so much because they don't feel like if he's not listening to me or he doesn't understand where I'm coming from. Sometimes, that is a challenge. It is a very real challenge that we face. It's just the way that we need to be able to take control of our own self. Say, look, if I leave the office, I know in myself I will not take this medication. I cannot afford to leave because the consequences of this action are too great. The price is too high to pay. Say, sorry, doc, I will not take this. Please prescribe something else. And I think that's the point I will add to it.
Sorry, I will keep on talking. I just want to say that, what you just described is very unfortunate. I don't want to gloss over the fact that a physician said, you people, because when I hear that, I pretty much hear like the N-word, because that's what it feels like. And so I think we need to be very openly say that not everyone who is a practicing healthcare provider is not anti-race, anti-black racism, right? So there's a lot of anti-black racism that we face on a regular basis. And I think it hurts more when it comes from someone that you've developed a relationship with, that's been your family doctor for 15, 20 years, to make a comment like that. Personally, what I would do and what I've advocated for other friends who felt minimized about their physician is to call and say, can I have another appointment? I want to talk about this because this is how you made me feel when this happened. Unfortunately, we don't get to pick from a massive list of family physicians, but I do think it's important to give that feedback back to the person that it's not okay. You don't talk to people like that. And so I guess on behalf of physicians, I'm sorry that you had that experience. That's completely not acceptable.
Thank you, Dr. Mole. And thank you, panelists, for addressing as best as possible our questions today and for taking the time out to be with us. We want to thank Dr. Jackie James, Dr. Mojola Omole, Dr. Kevin Evelyn, and of course, Natasha Batchelor for being on our panel. Dr. Evelyn, I'm going to task you with speaking further to our last questioner around how to also advocate through that. And stay tuned, everybody. The day continues. We'll have another panel later, but I also want you to circulate to all the tables that you're seeing here. There's lunch on site and more to come, and of course, giveaways and so on. So make sure you get your passport, your wellness passport, so that you can check off all your, get your stamps, because you'll be entered into a prize draw. Give our panelists a round of applause for taking the time out and contributing in this way to our wellness and family health fair. All right, guys, I'm Danae Peart, for those of you who are just coming in. I'm your host for the day. In my 9 to 5, I'm the executive director for a nurse practitioner-led clinic. Shameless plug, we're taking new patients. We are Islington near Steeles is one of our locations, and our other location is Eglinton near Kiel. So we have 2 locations to serve you, led by nurse practitioners, and they're all friendly and nice, or I'll beat them up. So the name is Emory Keelsdale Nurse Practitioner-led Clinic. So look out for us. And yes, if you're having challenges with your primary care providers, you might want to check us. All right, we're going to go over to our DJ D-Rock, and he's going to give us some music. You get to circulate some more. We're going to come back, and we're going to have a panel discussion. We're going to talk about more of this lovely health and wellness fair and all the things that we have offering here. Thanks, everyone.
Do you have a card? My mom needs a family doctor. And I have
I don't think they're ready for this. Dark child, I like that. Be the same. 'Cause girl, you came and changed the way I walk, the way I talk. I cannot explain the things I feel for you, but girl, you know it's true. Stay with me, fulfill my dues, and I'll be all you need. Feels so right, girl. in my eyes. So don't deny, I can't fool no one else. The truth is in the tears I cry. 'Cause if it isn't love, why do I feel this way? Why does she stay on my mind? And if it isn't love, why does it hurt so bad? Make me feel so sad inside. If it isn't love,
girl, you're looking sweeter now. Look better every day, girl. Wish that I could love you right in a special way. Ooh, like my mind, I feel alive with you, baby. You blow my mind. I'm satisfied. I'm so excited. It makes me wanna shout, baby. Gee, I feel so lucky, girl, to have you all alone. I really love the way you love me, girl. Ever I'll be yours. You blow my mind, baby. I'm so alive with you, baby. You blow my mind, baby. You blow my mind, baby. You light my fire. I feel alive. You blow my mind. I'm
you must understand. The touch of your hand makes my pulse react. That it's only the thrill of boy meeting girl, opposites attract. It's physical, only logical. You must try to ignore that it means more than that. Oh, what's love got to do with it? What's love but a second-hand emotion? What's love got to do with it? Who needs a heart when a heart can be broken?
I never knew there was a love like this before.
join me? Let's dance off some of the soup. Come, come. Come, the three of you come. The three of you come. Let's show them. When you hear the beats of the African drum, let's give them a teaser. Give them a teaser. That's right. That's right. Hey. Watch this now. Give them another round of applause. Woodskin Drum Ensemble. And we want to thank our impromptu dance session that happened a while ago, if you were paying attention. And you're going to see them come back, so don't worry about it. They are coming up next. They're going to be doing what we're going to just call movement. So you want to stick around for that, because we've been talking about health and wellness. And if you don't move, you know what happens. You get winded like me. So, ladies and gentlemen, Welcome again. If you're just joining us here at the Community Health and Wellness Family Fair, you have missed a lot. We hope you can catch up because you missed a panel discussion already. We have another one coming up, and there are a number of booths that you should be visiting. In the hall at the back, you can get your blood pressure checks done. In this hall, you can learn about breast and bone health from Humber River. You can learn about all the groups that are here that are offering services. There's Sickle Cell Association is here. All these groups are in this room. And of course, the section I haven't had a chance to visit yet, right behind me here, the massage folks. They are giving free massages. They can take up to 6 people. I don't know how you're not flooding that area yet. So please take advantage of that. And in the back room, there's a free haircut situation. We have barbers. Listen, everything for everyone. We even have activities for the children. So don't miss out. Are you doing a draw right now? All right, so we're going to do a prize draw. Where did they get this? Because I never get to enter. How this go? How did this go? Because I didn't get one of these tickets. You see? You see? It's okay. They're going to have multiple draws. It's okay. They're having multiple draws. This is just one. These were the early bird people. So clearly you did come late. She'll personally get you a ticket. It's okay. This is just one draw. We have multiple draws. See, all of that we're giving away. No, you're not in this one. You're not in this one. But this is just the first draw. So pay attention because more prizes and surprises. Are we doing more than one or just one at this time? We're doing 3 at this time. And it's for the baskets? All right. So pay attention. Pay attention. The draw. Since I don't have anything in there, I can pick. I have no bias in this box. 609-85532. 609-85532. Going once. Going twice. Going 3 times. Gone. Maybe that person came so early they've seen everything and left. I don't know. Let's see this one now. This person really came early. 069-708-31. 069-708-31. 069-708-31. Going once. Going twice. 3rd option out. All right. Try this one. 609-855-34. 609-855-34. 609-855-34. Check your ticket. Check your stub. Oh, we have a winner coming up now. 609-855-34. All right, here we have one of the winners. Maybe they're in the other hall, you know, they should, hopefully they can pay attention. Let's just verify. Yes, that's you. So she is one of the winners for sure. Congratulations. Let me see what's in this basket. Oh, Milo. Look like guava jelly, evaporated milk. What? You got hooked up. Flowers and garden basket here. Look at that. Congratulate her. She came early and she got in the prize. Okay, one more. 069-709-95. 069-709-95. 069-709-95. Going. 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 Okay. So these were called but not here. All right, one last try for a winner. Let me shake up again. 069-709-06. 069-709-06. You have it? 069-709-06. That's you? Look at this, we have a winner. Good job. So this is her. Congratulations. Look at this lovely basket. It's kind of heavy. If you need help, I can help you to carry it, I will take a few things home and you take home the rest. Oh, you're going to help her. Oh, sorry. I tried. Yeah. Okay, so we'll have more prizes and surprises throughout the day. Right now, we want to bring up our movement folks. Ready? Are you ready? So we're going to have our movement with Renika Hall. Hey. This is where you need to come and pay attention, because all of us need to situate ourselves here. There are some situations in the middle sections that we need to work out. And we don't sweat enough in this country. That's something I noticed. We don't sweat enough in this country because, we have 500 months of winter. So let us get moving with Renika and her company. Tell us what you go by.
My name is Renika. I'm actually a navigator for Black Creek, but Nadine will be facilitating the movement and our prescription. So let me jump right into it. Hi, everyone. Can you hear me? And if you can I get a yeah? I can't hear you. Okay, me like it. So, once again, my name is Renika. I go by Ren. I work with Black Creek Community Health Center. I've had the privilege to do dance programming for their women's program, for their seniors program, and performing with all of their events. I've had the privilege to take part in their meal delivery programs, especially during the heat of COVID. And now I am the navigator for the Black-focused social prescribing project. It is a long time. Yeah, big it up. It is a long title. It goes by BFSP for short, and BSP as well. And the Black Focus Prescribing Project is a holistic project newly launched, and there's 4 CHCs taking part. So Black Creek, Rexdale Community Health Center, Taibu representing in the East End, and Somerset West in Ottawa are the 4 pilot CHCs for this project. And why are we doing this project? We've spoken a lot and heard many things about the ways that our community, the Black community, have not received health care in ways that suit our needs, discrimination, racism, countless things that have set us apart and poorly affected our health and our well-being. The Black Social Prescribing Project is going to change that and allow us to navigate a for us, by us program to support our community, our needs, different things that we are particular to the Black and the huge African diaspora, okay? So what is that gonna entail? Well, as a navigator myself, I can receive referrals and prescriptions for people within the Black community who may need to receive supports other than medicine, other than taking pills. There's so many other things that can benefit your wellness. Getting your hair done. I don't know about you, but ladies, when I oil my scalp, I'm a new person. The stress is lowered. I feel free. When we eat the right foods for us with the right seasonings, ginger, turmeric, onion, that works for us. So there's different ways to receive holistic medicines. So the Black Social Prescribing Project is going to navigate with each family and client individually to see what they need, and we socially prescribe that. It could be food, it could be a walk in the park, it could be a dance class, it could be a drumming circle. And we want to ground it in Afrocentric values and principles. So just like today, all of us coming together, learning from each other, sharing music, dance, food, that is an Afrocentric communal way of coming together to heal. And today, I would like to offer a prescription for us all to enjoy. So if you're in the back, come on up. You want to hear this? I'm going to introduce Nadine, who will be leading and facilitating our social connection and movement prescription. Nadine is an actress. She's a choreographer, a mover, a voiceover artist, countless others on her resume. She's also a mother. She's from the UK, but she now lives here in Toronto, and she's sharing her skills and all her expertise. You can connect with her later because there's other things she does one-on-one, but for today, she's gonna come together and facilitate a group activity. So ladies and gentlemen, kiddies, can we all give it up and welcome Nadine?
Hello everyone, good afternoon. Okay, before I start some movement, because we will be dancing, we will be shaking our leg, I wanted to, because we're talking about wellness today, I wanted to talk about how important performance art is. And I specifically teach dance and drama. As Renika said, I have a lot of hats. I act, I dance, I choreograph. But especially after COVID, I've been working with a lot of psychologists because especially in our community, and I'm just talking to parents out there, we like to, which is great, and I don't say go against it, but we like to push our children, you could be a lawyer, be a doctor, be a scientist, which is great, but there's no emphasis on dance, on performance art, on music, on drama, and it's very, very important. Over COVID, like I said, I've been working with a lot of psychologists. I had people come to me, psychologists refer their clients to me because of all the being isolated, or I also had people that got promoted and in their profession and they found public speaking difficult. They thought social interaction difficult. And drama, acting is very, very good for that. It's very good for your enunciation. It's very good for making you feel good in oneself, because when it concerns any kind of performing art, it gets rid of your inhibitions. It makes you feel more confident in yourself. So I want you to understand, if you just see the acting and dancing, yeah man, it's just an extracurricular thing. No, it's very, very important. I have restaurateurs, I have doctors, I have dentists that come to me. They've been in the books for many, many years. But now when they have to do certain things, they do not have the right skills. They don't know how to talk to people. Their social interactions are very, very low. And not only that, they don't have confidence in themselves. Now, when the children go to, and I'm talking specifically to parents, when your children do performance, especially drama, I'm going to get into the dance, but especially drama, they do things such as role play. So if there's things that might be bothering them, they get to do reenactments of thinking, how do I approach certain things? How do I talk about that? And they also get the opportunity to be more creative and think about their own ideas and how they're important they are. So it's very, very, very important. Public speaking, your self-confidence, and feeling great about yourself. So please do not ignore. Don't think it's just something small, because I have a lot of clients in all different professions that realize after how many years that they're missing certain skills that you need to survive as individuals, okay? All right, after my lecture, I wanted to tell you specifically about dance, okay? So the obvious, it keeps you fit, all right? We're talking about fitness, and it makes you stretch, and it's the best cardio there is because it works every single muscle. If you saw me dancing over there, I'm moving from my fingers to my toes to my tips of my fingers. It makes you stretch, feel good about oneself, okay? And it's a scientific fact. When it concerns dancing, it releases endorphins that make you feel good. It makes you feel excited. So when you feel a good tune, you start move like this. Oh, because the tune feel good. Oh, it makes you feel good. It releases endorphins. It makes you feel happy. So it's so very, very important for your well-being. Not only did I get psychologists telling me, okay, they need to come to you for their public speaking, their enunciation, but it was also because when you're doing dancing and so on, like I said, it makes you feel good. It was also good for this. It was also good for this. Good. 3, good, thank you. And 4, bring it forwards. And 1, and 2, and 3, and 4. Okay? We're going to just reach over across your body. We're just stretching. Great. Another side. And stretch. Great. Sorry, I'm going to pull over too. And pull over this way. Great. Fantastic. And your other side. Side. Forward, side, back, side. And try smooth. Other way, smooth. Again, we're going to do forward side one more time. Back, center, forward, side, back, center, and smooth. Great. One more time, and smooth. Okay, we're moving to our hips. Gonna sit down like we're sitting on a chair, feet, and swap. Thing, it's not for any reason. It's connect us to our ancestors, flat to the ground. Okay? Secondly, we have our hip isolation. So you see when people whine, there's a reason for that. I will tell you in a minute. And you also will have a lot of back isolation. Now, in the Caribbean, you'll see a lot of cultural dances. You'll see quadrille. Anybody know what the quadrille is? Anybody heard of the quadrille? Okay. Now, in Europe, you'll see they used to see the European dancers, they would dance like this. And they're wondering, what are they doing? Okay? So basic quadrille is 1, 2, 3, 4. 1, 2, 3, 4. Now, when the Africans saw this, they thought, oh, because culturally, when we dance like this and tight, it feels like we're not enjoying. With our dance, it was about celebration. In births, weddings, party, birthdays, funerals, yes, at funerals. Okay, it was about celebrating life. So this is why you see the hip movement here. When the Europeans saw it, they said, oh my gosh, that's so lewd and disgusting. But it wasn't. It was celebrating life. It was something that was very important culturally. Now, before I go into the quadrille, and we'll do some movement of the quadrille, I will do the Dinky Mini. Everybody heard of the Dinky Mini from Jamaica? Nobody heard of the Dinky Mini from Jamaica? Yes, some people say yes. Then you will see the hip isolation in the Dinky Mini. All right? And you will see. So we're going to do some Dinky Mini. But before you do that, I want your feet flat to the floor. One of your foot's on the balls of the feet. And you're wiggling your hip up, down, up, 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 up. And when you're swishing, you swish your foot at the same time. Now, sometimes people can do it knock knee like so. All right? Okay? And then when I say there's a reason for it, so Dinky Mini you will see usually in St. Thomas, okay? And it was whenever after 9 nights when somebody died, you would usually see it on the 7th night. Okay, so when we talk about dancing and stuff, it's not just to jump up and down. It was always for a particular reason. So I want you to understand, if you see cultural dance workshops for your children to go to, let them participate. It keeps them connected to their culture. Okay, DJ, you ready for the Dinky Mini tune? Okay. Okay, before we start the foot kick, we're gonna get our hip ready. I want your hip moving side to side. Side, 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 side. Okay, we may have one knee bent, and that hip is gonna go up a little bit more. Up, 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 up. One on the foot is like you're tapping the foot. Tap, 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 tap. Let me see a Dinky Minima. Okay, you can play with the movement. You can go forward and backwards. You can go side to side. You can bend down low. Just make it do humility. You can play with the top. You can bend down low. Just play with your dicky mini. Let me see. Okay, we're gonna go forward and backwards. Ready? 4 forward, 4 backwards, 4 side, other side. Ready? We go. 1, 2, 3, 4, back. 2, 3, 4, this side. 3, 4, this side. Now low. Bring it up. Now low. Bring it up. Turn around. Let's go. Let's try turning your upper torso, like I talk about back isolation. Ready? Try. Let's go again, forward and back 4. Ready? 1, 2, 3, 4, back. Side. Good. Let's go low. Bring it up. Go low. Turn around. Circle. Thank you. Okay. Now we're going to do a little bit of quadrille. Can I steal your giant Renica for a second? Okay. Now, like I said, when the Africans saw the Europeans do the quadrille, it was basically just a 4-step. 1, 2, 3. 1, 2, 3. Now, when the Africans saw this, like I said, they didn't understand it. They said, where's the hip? Where's the bend down low? Where's the rhythm? Where's the syncopation? Where's the sauce? Where's the spice? So they added their hips and add a little beat to it. So we're just going to try and show you. So I would like you, if you have a partner, can try. If not, you can do it by yourself. It's simply a 1, 2, 3, and when you're at 4, you bend here. 1, 2, 3 to your partner. Again, 1, 2, 3. 1, 2, 3 to your partner. We're going to try that with the same song. Ready? 2, 1, 2, 3. We go. And 4, 4, 4, 4, 9. Good. Well done, guys. Thank you, DJ. Right, last thing. Like I said, dance and doing cultural dance workshops is very, very good, especially as a black community, keeping us connected to our culture. Now, when I speak about Caribbean, I'm not just speaking about English-speaking Caribbean, Jamaican, which my background is from, my parents are from. I'm talking about St. Lucia, Grenada, Cuba, Puerto Rico. Now, when I teach and I travel, people always assume that salsa is not an African dance. Absolutely wrong. Now, when I said that these things are very important, you used to see these things in death, birth, all different parts and reasons of your lifetime. So salsa is come from the dance step called Cha-Cha-Kufun, which is from the Yoruba tribe from Nigeria. Now I'm going to show you, and you'll see the similarities. Cha-Cha-Kufun, you will step back, 2, 3. Step back, 2, 3. Back, forward, forward. Back, forward, forward. Now, just because they speak Spanish, it don't mean that it's not your culture. It's from the same roots. Okay? 1, 2, 3. 1, 2, 3. Now, the dance evolved. So, like we know, like with quadrille, you see the African elements, European elements mixing together, where you dance with a partner, which is the European culture, mixing with the African culture. So with the Cha-Cha-Kufun, they started working, they mixed it, put in with the partners, and then you'll see the hips. But the same thing stays the same as the step 1, 2, 3. So I'm going to do the basics with you, and we're going to finish off doing some salsa, guys. You ready to do some salsa? Hey, what? Good. So I'm going to do the basic salsa step for you. 1, 2, 3. Just like Chacha Kufung, but it's side to side. 1. Actually, we do simple 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now we're not like bread with no butter. It's not dry like that. You add your hips. Okay? 1, 2, 3. 1, 2, 3. Add your hips. 1, 2, 3. You can add your arms. 1, 2, 3. 1, 2, 3. 1, 2, 3. You can also go forward and backwards. We'll go forward on your right. 1, 2, 3. Back, 2, 3. Now go back on your left. Forward, 2, 3. Back, 2, 3. Add those hips. 2, 3. Back, 2, 3. 1, 2, 3. Back, 2, 3. Now, the next one, DJ. You ready, guys? We're going to go slow first, so don't go fast. Ready? 2, 3, slow. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Forward. 1, 2, 3. Don't forget your hips. 1, 2, 3. 1, 2, 3. 1, 2, 3. We're going to go the right speed. So just watch me first. It's the right speed. Okay? Ready? 2, 1, 2, 3. We go. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Go forward. 1, 2, 3. 1, 2, 3. 1, 2, 3. Nice. Let's go again. Side. 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 Hands. Nice. Good. DJ. One more. 2 more steps for you to learn. You guys good? Doing good so far? Good. Yeah, yeah. Okay. 2 more steps for you to learn, and then I'm done. Okay. All right. So 1 out, 2, 3. So you keep that foot in the center. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. At your hips. 1, 2, 3. 1, 2, 3. Now that foot stays like it's stuck on the floor. Okay? 1, 2, 3. We go forward on that right. 1, 2, 3. Back on the left. 1, 2, 3. Well done. 1, 2, 3. 1, 2, 3. Let's put them all together before we add the music. Ready? 2, 3. We go. 1. Let's go to slow speed first. We're getting excited. Ready? 2, 3. We go. 1, 2, 3. 2, 2, 3. Again. 1, 2, 3. 2, 2, 3. Bring it back. 1, 2, 3. 1, 2, 3. Good. 1, 2, 3. 1, 2, 3. Let's go to right speed. Ready? 2, 3. We go. 1, 2, 3. 2, 2, 3. Again. 1, 2, 3. 2, 2, 3. Forward right. 1, 2, 3. Back 2, 3. 4, 2, 3. Back 2, 3. Fantastic. When the music comes on, we're going to do the 4 that you learned before, which is this together. 2, 3, 4. Forward. 1, 2, 3, 4. Then 1, 2, 3, 4. Then 1, 2, 3, 4. Slowly first, then the right time. DJ, when you're ready. Ready? 2, 3, we go. Slow. 2, 3. 1, 2, 3. Don't forget those hips. 1, 2, 3. 1, 2, 3. Forward. 1, 2, 3. 1, 2, 3. Again. 1, 2, 3. 2, 2, 3. Slowly. 1, 2, 3. 1, 2, 3. Again. 1, 2, 3. 2, 2. Back. 1, 2, 3. 2. Again. Back. Woo! Let's see my socks. Okay, let's speed it up. I made a mistake. Go forward if you're right the first time. Ready? 2, 1, 2. Right speed. We go. 1, 2, 3. 2, 2, 3. 3, 2, 3. 4, 2, 3. Hey, 1, 2, 3. 2, 2. 3, 2, 3. 4, 2. Separate. 1, 2, 3. Forward with your right hand. 1, 2, 3, 4. Let's go again. 1, 2, 3, 4. 1, 2, 3, 4. Separate. 1, 2, 3, 4. Right forward. 1, 2, 3, 4. One more just for fun. 1, 2, 3, 4. Thank you. Well done, guys. Understand, dance is not just jigging up yourself. It's good for your culture, connecting with your history and your culture. It's good to keep you fit. It's good for your mental health. It's good for your spirit. It releases endorphins and makes you feel good. Thank you.
Give it up again for our great instructor in movement. Play that track again, Joshua. How it goes? Let's keep moving and moving and moving. Listen, no, I'm tired already. It's okay, Joshua. I tried. Ladies and gentlemen, welcome to those of you who are just joining us. I don't know where you have been. You've missed an event that's packed with all kinds of information, activities, and more. We are utilizing all of the halls of the Jamaica Canadian Center, and we have so much in store for you. Now, I need you to take down the noise just a little in this hall. Can you take down the noise just a little? Can you pay attention just here? Can you pay attention just here? Just right here. I know some of us are doing reunions because we haven't seen anybody since the storm. But let's just take it down a notch. Take it down a notch. Hello, hello. Hello, hello. So the reason I want you to take it down a notch is because I'm about to bring to this stage one of the top performers in this city right now. She goes live on her Facebook channel every Wednesday and has brought us joy throughout the pandemic. When I tell you she can belt, when I tell you she can sing, or as we would say in the black community, the girl can sing, I'm talking about Ms. LaToya Mullings. Put your hands together and welcome to our fair, the one and only LaToya Mullings.
Thank you so much for such a beautiful, beautiful introduction. How's everybody doing? All right. I want to be able to hear myself real good. Let me see. About right here. All right, so who's playing? You or you? Okay. So I know I gave you guys a set. Just follow me. We'll just freestyle it. All right, so, music played an integral role in the escape and freedom of our ancestors. They would sing songs like Swing Low, Sweet Chariot, Coming Forth to Carry Me Home. Swing low, it would mean they're communicating in coded communication, then I should say. And swing low meaning be careful not to get caught. Be careful. Tell all your friends that I'm coming to. If you get there before I do, tell all my friends that I'm coming to. So swing low, swing low, swing low. All right. Yeah. Music. All right, are you ready? Perfect. Yeah. Come on. Oh, yeah. Swing low, sweet chariot, coming for to carry me. Oh, swing low, sweet chariot, coming for to carry me home. Turn it up, DJ. Swing low, sweet chariot, coming for to carry me. Oh, swing low, sweet chariot, coming for to carry me home. If you get there before I do, coming for to carry me home. Tell all my friends that I'm coming to, coming for to carry me home. I say I looked over Jordan, what do I see? Coming for to carry me home. It was a band of angels coming after me, coming for to carry me home. Oh, swing low, sweet chariot, coming for to carry me home. Sweet home, swing low, sweet chariot, coming for to carry me home. Swing low, oh yeah, coming for to carry me home. Swing to home, Lord, swing low, sweet chariot, coming for to carry me home. Swing low, sweet chariot, coming for to carry me home. Swing low, sweet chariot, coming for to carry me home. Swing low, swing low, swing low. Home, sweet home, swing low, sweet chariot, coming for to carry me home. All right, sweet chariot. Give me number 4, please. Thank you so much. So I want you all to just relax and enjoy these Sunday afternoon tunes. Hit it, Mr. DJ. I'm ready when you are. Oh, yeah. Ooh, oh, oh, ooh. If you could see me now, the one who said that she would rather roam, the one who said she'd rather be alone. Oh yeah. If you could only see me now, if I could hold you now, just for a while, if I could really make you mine, just for a moment, turn back the hands of time. If I could only hold you now, 'cause I've been too long in the wind, too long in the rain, taking any comfort that I can, looking back and longing for the freedom of my chains. I can almost feel your loving arms again. Oh, baby, oh, yeah. Ooh, ooh. tonight, dreaming of the arms that held me tight. If I could only see you now, 'cause I've been too long in the wind, too long in the rain, taking any comfort that I can. I'm looking back and longing for the freedom of my chains. I can almost feel your loving arms again. Oh, oh, baby. Oh, yeah, yeah. Too long in the wind, too long in the rain, taking any comfort that I can. I'm looking back and longing for. I can almost feel your loving arms again. I can almost feel your loving arms again. Oh, oh, baby. Oh, yeah. Woo! Thank you. Give me natural woman, please. Thank you so much. Looking out on the morning rain, I used to feel so uninspired. And when I knew I had to face another day, Lord, it made me feel so tired. Before the day I met you, my life was so unkind, but you're the key to my peace of mind. 'Cause you make me feel, you make me feel, you make me feel like a natural woman. When my soul was in the lost and found, ooh, you came along to claim it. No, I didn't know just what was wrong with me, ooh, till your kiss helps me name it. No, I'm no longer doubtful for what I'm living for. 'Cause if I make you happy, I don't need to do more. Yeah. 'Cause you make me feel, you make me feel, you make me feel like a natural woman. Oh, baby, what you done to me. You make me feel so good inside. Oh, and now I just don't wanna be close to you. You make me feel so alive. Oh, yes. You make me feel like a natural woman. Yeah, yeah. Feel like a natural woman. Yeah, 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 yeah. Woo! Thank you. Thank you so much. You all make me feel like a beautiful, natural woman that I am. So you know what I'm going to give you? Some R-E-S-P-E-C-T. Is that all right? All right. Come on. Woo! What you want, mercy, I've got it. What you need, do you know I've got it? All I'm asking is for a little respect when you get home. Baby, give it to me when you get home. Just a little bit. Ain't gonna do you wrong while you're gone. Ain't gonna do you wrong, 'cause I don't wanna. All I'm asking is for a little respect when you get home. Baby, give it to me when you get home. I'm about to give you all of my money, and all I'm asking in return, honey, is to give me my promise when you get home. Baby, give it to me when you get home. Woo! Come on, do your hands like this. Sing it with me, baby. Woo! All right. Ooh, your kisses sweeter than honey, and guess what? So is my money. All I want you to do for me is give it to me when you get home, baby. Give it to me when you get home. Just a little bit. R-E-S-P-E-C-T. Find out what it means to me. R-E-S-P-E-C-T. Take care of TCB. Wow, yeah. Whoa, baby. A little respect all the time. Give it to me, baby. It will do fine. Just a little, yeah. Respect. Oh, we need it. Give it to me, baby. One more time. Show up, 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 show up. Woo! All right. You ready for me? Oh, okay. Woo! Oh my God, you guys are awesome. Cupid, you guys are so awesome. How about a little reggae? Is that all right? Y'all like reggae music? All right. Let's do this. Cupid, draw back your bow and let your arrow flow straight to my lover's heart. For me, yeah, yeah, yeah. Nobody else but me. Cupid, please hear my cry and let your arrow fly straight to my lover's heart. For me, yeah. No, I don't mean to bother you, but I'm in distress. There's danger of me losing all of my happiness. I love a man who doesn't know I exist, and this you can fix. So, Cupid, draw back your bow and let your arrow flow straight to my lover's heart. For me, yeah, yeah, yeah. Nobody else but me. Cupid, please hear my cry and let your arrow fly straight to my lover's heart. For me, yes. Now, Cupid, if your arrow makes his love strong for me, I promise I will love him until eternity. I know between the both of us his hearts we can steal. So, Cupid, help me if you will. So, Cupid, draw back your bow and let your arrow flow straight to my lover's heart for me. Yeah, yeah, yeah. Nobody else but me. Cupid, please hear my cry and let your arrow fly straight to my lover's heart for me. For me, yes. Oh, Cupid. Yes, Cupid. Oh, Cupid. Yes, Cupid. Oh, Cupid. Oh, Cupid. Yes, Cupid. Woo! Last one, and that's it. Is that all right? Number 5, people talk. I want it long, but we'll do it. Turn it up, DJ. People talk, that's what they do. They don't understand how me still I push and go through. Yes, they laugh, they call me names, but they just don't get it. Oh, them see me, I hold my head up just the same. When them see me, them just keep on talking, but me not see them, I just keep on walking. I've got my pride, me not gon' show me bad side. Some of them see me as a big pushover. Let me fit that, them think I'm gonna keen over. Oh no, not I and I will survive. Never let them get you down. Never let them see you proud. Never let them take away your liberty. Live your life and be free. Never let them get you down. Never let them see you proud. Never let them lead you astray. Starting today, live your life and live it your way. Woo! I love it, I love it, I love it, I love it! Hey! Mighty, oh yeah! Oh yeah! All right, raise your hand if you know you're not afraid. Come on! Woo! Oh yeah! Da-da, da-da, da-da. Woo! I see them coming after my soul, wanting to take control. They wanna give me locks, they wanna give me bling, wanna give me all the material things. I hear them talking about what this world has to offer. Girl, what you doing? Don't you see what they have done to Bedford and Marcus? Just as another prophets. But I am not afraid. No, I am not afraid. Sing it with me. I am not afraid. No, if them I come, make them come. 'Cause I'm protected by the Most High One. They don't mind when you fall behind. I can't pay your bills on time. You're prostituting and standing in a them government line. Oh, they don't mind when you waste your time coming up with some stupid rhyme, influencing the youth them fit. Do you think they mind? But I am not afraid. Sing it with me. No, I am not afraid. No, say I am not afraid. No, if them I come, make them come. 'Cause I'm protected by the Most High One. See them coming after my this world has to offer. Girl, what you doing, don't you see what they have done to backward and mark us? Just as another prophets, but I am not afraid. No, 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 I'm not. I can't hear you. Let me hear you. I am not afraid. Sweet song. Oh, they don't mind when you fall behind and can't pay your bills on time. You're prostituting and standing in a them government line. No, they don't mind when you waste your time coming up with some stupid rhyme, influencing the youth them to take a life. Do you think they mind? But I am not afraid. Sing it with me. I am not afraid. Lord of mercy, I am not afraid. No, if them I come, make them come. 'Cause I'm protected. I love you all so much. Thank you. My name is LaToya Mullins. I want you all to do one thing. Take your phone now, please, and follow me on Facebook at LaToya Mullins Music. Facebook or YouTube. Promise me you're going to do it. I really love and appreciate all of you. Thank you for having me. God bless you. Thank you.
Give it up again for Miss LaToya Mullins. And you heard her say it. You should follow her online, YouTube or Facebook. Make sure you follow her, LaToya Mullins Music. There is no mystery in the spelling. How you think it's spelled, that's how it's spelled. Follow her now and keep up with her. And if you love this kind of music, you can hear her on Wednesdays on her Facebook. She goes live from her car in the morning on the way to work. So you want to hear all the beautiful vocals that you just heard now. Give her another round of applause again. We want to thank everybody who has made it here. Do you have your passport to health? Have you been going around to all the tables and getting your stamp? Because there's a draw for that. We're about to do a ticket-related draw now, and we have some beautiful baskets. Want to let you know that the dental hygienists are on site. They're behind me on stage. So, you know, dental health is also very integral to our overall health. So make sure you visit them today. Also, to my right, maybe your left, you will see a sign that says massages. Free massages are happening around there. Go de-stress, go detangle your body. Right around here, you can get some free massages. They can take up to 6 people at a time around there. So, you know, make sure you take advantage of that. And we're going to do the prize draw. I'm going to come around to some of the tables, and then we're going to have our second panel for the day. So panelists, I ask you to get closer because we're going to go up to the stage at 2 on the dot. Okay, let's do this. So take out your stubs. All right. Number you're listening for is 255-955-41. 255-955-41. We have a winner? All right. We'll get that basket. 255-955-41. All right, next up. She's gonna get your basket. Okay. Next one. 255-95473. 255-95473. That's you? Come on up. I like when you win because if you win, I win. I'm taking home some of it. Okay. And we'll pull one more. Go over to them. So one of them is 255-955-41. That should be her. No, that's her. She's 41. You're 43. You're 73. Yes. So that's her, 473. All right. It's okay. I will help you. If you need help, I can help you take it home. Okay, 609-85661. 609-85661. All right, come on down. All of these people are my close friends. All of a sudden, I will get what's in the basket. Look at this lovely basket with all these products. Yes, I like Milo, She not even look at me. Okay, 255-955-21. Hey, how are you? 255-955-21. Going once. 255-955-21. Going twice. 255-955-21. All right, we're going to shake again. All right. Let me see what this says. 069, this is an early person. 069 708 87. 069 708 87. Going once. 069 708 87. Going twice. No? All right, and one last try. Okay, 255-954-46. 255-954-46. 255-954-46. 255. All right, we have a winner. Congratulate my new friend here. Yes, he will get help from me, yes? All right, congratulations to all the winners. We still have more prizes to go, so stick around. I noticed we have our MPP in the building, Tom Rakosovic. Can you come up and give us a quick welcome? Let us know why these kinds of health fairs are important.
Thank you so much. Good afternoon, everybody. How you doing today? You know what? This is the coming up together of two amazing places in our community, two of my favorite places, the JCA and Black Creek Community Health Center. And so the operational word here is quick, so I'm going to make it real quick. I just want to say that I love both places because both places have done so much for our community. They're truly gems. The health of our community is so important. My dad used to say to me when I was a kid, if you don't have your health, you got nothing. You could be the richest, most successful, powerful person in the entire planet, but if you don't have your health, you don't have anything. You can't truly enjoy that. And so what these two people are doing, these groups are teaming up, and especially BCCHC, they are helping people every day in our community. And it is so important to invest, for the governments to invest in these places. And if you live in our community, reach out to them because they're always here to help. So it's a real honor, a pleasure to be here, and I brought my son Alexander, all right? So have a wonderful, wonderful day, everybody. Stay healthy.
Thank you, our own MPP for the area, Tom Rakosovic. And I'm going to ask our panelists to come forward. Let me just name you so you know who I'm talking about. Our panelists, we're going to be talking about resources in our community. So, Donna Alexander, Gregory Leslie, Anthony Henry, Margarita Fidler, Falgoni Capadia, and Karen Fleming. Please come up to our panel. We're going to be going...
Is this a prize? This is a prize, isn't it? 4, 6. Okay, okay.
I'm still you, boy.
As our panelists get ready, we ask that you take the levels down in terms of noise in this area so that we can pay attention to what's going to happen up here. I'm going to get another chair for us. We do a bit of a circle. I'm going to move you. No, you can take this chair. I'll just take it. Everybody has a spot? All right. Come in with us. Come in. Come in with us. Okay. So, this panel is going to be talking about resources available to our community. And we have a number of persons here that will help us go through that process and educate you more. They're going to do a little bit of presentation, and then you'll get a chance to ask questions and have them expand on the conversation that we're starting here. So we ask that just a little bit of quiet. What kind of car? Do we know? License plate number ASMK 154. I hope you know your license plate number. You're blocking. You're a fire hazard. ASMK 154. ASMK 154. Not sure what type of vehicle, but you are blocking. Please remove your vehicle. Okay. So, we're going to be talking to, of course, you're going to have to wave and introduce yourselves so everybody knows when I call your name, okay? All right. So, we have Donna Alexander. Donna Alexander is RSW, and she's with CAMH. So, of course, we're going to be talking about mental health resources. Gregory Leslie. Give them a wave. Gregory Leslie is also an RSW. He does Educare Self-Care Studios. So we'll hear more, of course. Anthony Henry. Anthony Henry is the vice president of the Walnut Foundation. And you'll want to hear about them and what they do. So you've got to stick around. And then we have Margareta Fiedler and Falgoni Capadia, and they are community nutrition educators with Toronto Public Health, and they'll tell you more what that means. And of course, Karen Fleming, right here beside me, just wave for them so they know. And she's a health promoter with Sickle Cell Awareness Group of Ontario, that's SCAGO. Okay. So we're going to first go around the table and have you just tell us a little bit about what you do and the resources that are available, and then we'll get into some questions, of course. So we're going to start right at my left here with, whether or not you're ready, we're going to start with you, Karen. Tell us a little bit about SCAGO.
Good afternoon, everyone. It's a pleasure to be here today, so thank you for having me. The Sickle Cell Awareness Group of Ontario is a nonprofit organization that really focuses on raising awareness about sickle cell disease. And one of the most important things I'd say this organization does is does a lot of networking with various other organizations, with schools, with the government, with healthcare providers, because sickle cell, it is vast. It impacts all organs, all aspects of your health, and so having access to resources is needed, and actually I would say for sickle cell, they're too scarce. We need more. Current resources, certainly you can connect with SCAGO. There's resources for scholarships. There is mental health support through our counseling services. There are supports for schools, like if you're having trouble with your teachers, trying to explain something about your child, we can help support that. And I feel like I'll pause there. Right?
Good afternoon. My name is Gregory Leslie. I'm a registered social worker, psychotherapist. I provide mental health and trauma support to individuals and family dealing with mental health or trauma-related issues. To break that down a little bit, what that means is if you've experienced mental health for the first time, it would be considered psychosis. So I would help you get a better understanding of what you're dealing with. If it's something more formal, like schizophrenia or bipolar, just helping you to develop a healthy lifestyle and proper coping skills as you manage on your health journey, as well as providing trauma-focused therapy for individuals who have been impacted by serious crime. So if you or a family member are dealing with a grief or loss situation, then I would provide trauma-focused therapy to help you understand the impact that your stress and or trauma is having upon you. And we'll continue the conversation as we go deeper.
So thank you. Good afternoon, everyone. So like Gregory here, I'm also a registered social worker with a specialization in addiction and mental health. I think this whole issue of mental health right now is very topical. It's very urgent. I work out of CAMH, out of an ethno-specific program, the substance abuse program for African, Canadian, and Caribbean youth. So we serve children 13, youth 13 to 25. A little bit of good news is that last year we got some extra funding. So with the money that we got, we were able to expand services across Ontario. So now we're now a provincial-wide program with locations. So we were